we are going to have a participant, actually a speaker, who is an interpreter who volunteered to be here with us. And it's Anjana. Anjana, can you please open your, yes, there she is, Anjana Punjabi. Anjana, I'll ask you to introduce yourself, please, before you start.
Absolutely. Thank you very much for giving me this opportunity today. Hello, everybody. My name is Anjana Lachman, and today I'm going to talk about legalizing medical cannabis in Panama. But first, let me tell you a little bit about me. I'm born and brought up in Panama and a full time Spanish English conference interpreter and translator. My parents are from India, so I enjoy the beauty of both Eastern and Western cultures. I wonder if we can start the slides.
Okay, so Rafael is going to share the slides.
Thank you.
And again, thank you so much for volunteer to be our speaker today.
It is a pleasure. Thank you for giving me the opportunity. So let's go ahead and start with slide number 2. The next slide.
I think you need to enable edition first, Rafaela, before you are able to move the slides.
Okay, just give us a minute. I think that's slide 3, though. Can we go back a slide? Yes, thank you. No, actually, the one before. There we are. So, cannabis refers to a group of 3 plants with psychoactive properties known as cannabis sativa, cannabis indica, and cannabis ruderalis. Now, before I continue, I would like to thank Ms. Rosangela for the history of cannabis, because we're going to talk I'm going to go a little bit more in detail with that. So, but Rosangela's speech was an awesome start for this. So, cannabis is a psychoactive drug from the cannabis plant. It is native to Central or South Asia, and this plant has been used as a drug for both recreational and entheogenic purposes and in various traditional medicines for centuries. Other common names for these plants are marijuana, yarn, and I'm going to ask the interpreters to keep these names as they are because these are other names for the same plant. So again, marijuana, yarn, pot, weed, hash, dope, ganja, joint, etc. Can we go on to the next slide? So tetrahydrocannabinol, or THC, is the main psychoactive component of cannabis, which is one of the 483 known compounds in the plant, including at least 65 other cannabinoids, such as cannabidiol, also known as CBD. Next slide, please. Cannabis can be used by smoking, vaporizing, with food, as an extract, and it comes in different forms. Users report that the subjective effects of cannabis can vary depending on the form consumed. So as you can see in my slide, we have the dried buds, the hashish, the hash oil, and the concentrate. So let me tell you a little bit more about these. Marijuana, or the dried leaves and flower buds of the cannabis plant, are smoked usually in a joint. This is the most common form. Then we have the hashish. We have the dried plant resin that is usually mixed with tobacco and smoked or added to foods and baked goods such as cookies and brownies. Then we have hash oil, which is a liquid that is used sparingly due to high potency and added to the tip of a joint or cigarette, and it's smoked. Finally, the concentrates, the extracts which are often vaporized in small quantities due to high THC content. It is important to mention that there are no safe level of drug use. The use of any drug always carries some risk. Cannabis affects every individual differently. Even the same person may have a different experience on separate occasions over their lifetime. As mentioned earlier, cannabis can be put into various foods. This is generally called edibles. It usually takes between 1 to 2 or 3 hours to feel its effect. Impatient or naive users might think that they have not taken enough to feel the effects, and they might consume even more and more. But then they might experience unpleasant and strong psychoactive effects. When edible products have inconsistent levels of THC, even experienced users may find it difficult to control the amount consumed. Next slide, please. A factor that often confuses people is whether the CBD in the products comes from hemp or does it come from cannabis. And the short answer is that they derive from different varieties of the cannabis sativa plant. The word cannabis is often used to replace marijuana, a term with a history of racist associations, but we'll leave that talk for some other time. However, marijuana is still legally defined as cannabis that contains more than 0.3% THC content by dry weight, while hemp refers to cannabis with less than 0.3% of THC. Basically, hemp plants generally contain more CBD, and marijuana plants contain more tetrahydrocannabinol, or THC, which is the psychoactive compound that causes the high that people associate with marijuana use. In the US, the 2018 Farm Bill removed hemp from the legal definition of marijuana in the Controlled Substances Act. This made some hemp-derived CBD products with less than 0.3% THC federally legal. However, CBD products containing more than 0.3% THC still fall under the legal definition of marijuana, making them federally illegal, but legal in other states. So basically, over the 0.3% THC will be considered illegal, but then lower than 0.3% THC is considered hemp-derived. Also, keep in mind that FDA has not approved non-prescription CBD products, and some products may be inaccurately labeled, so we need to watch out for those. Next slide, please. CBD doesn't contain tetrahydrocannabinol. It is one out of 100 components in marijuana that does not cause a high by itself. The usual CBD formulation is oil, but CBD is also sold as an extract, as a vaporized liquid, and an oil-based capsule. Food, drinks, and beauty products are among the many CBD-infused products available online. As a matter of fact, the FDA has approved one plant-based marijuana drug called Epidiolex, which contains a purified form of CBD. The prescription medication is approved for treating seizures associated with 2 rare and severe forms of epilepsy. Next slide, please. CBD is also used for anxiety, pain, muscle disorders called dystonia, Parkinson's disease, Crohn's disease, schizophrenia, diabetes, multiple sclerosis, and many other conditions. But there is no good scientific evidence to date to support these uses. Like any other medication, CBD can cause side effects, such as dry mouth, diarrhea, reduced appetite, drowsiness, and fatigue. CBD can also interact with other medications that a person might be taking, such as blood thinners. Well, now that we know these plants a bit better and cleared off some of the confusion, let's see what happened in Panama in an attempt to legalize the substance. Next slide, please. Por un día sin dolor, for a day without pain, was the forceful expression and motto that encouraged the signing at the third reading of the Bill 153 that recognizes the legal status of the use of cannabis within medicinal and therapeutic properties. You see, treatment with medical cannabis is an emerging therapy for different pathologies, such as in cases of multiple sclerosis, nausea, induced by chemotherapy, and most importantly, alleviating chronic pain in many other diseases. So this resulted in a 5-year struggle carried out by the chronic patients and their relatives. Patients with chronic degenerative diseases, the Ministry of Health, the National Directorate of Pharmacies and Drugs, the Ministry of the Presidency, the Public Ministry, Ministry of Agriculture, Ministry of Security, you name it. amongst other important actors, participated in these meetings. Once approved, this bill would give quality of life to the patients, especially for people with epilepsy who take 2 or even 3 medications without feeling any relief. It will also improve the quality of life in children with refractory epilepsy and of their relatives who suffer by their side. Because we all know, the patient suffers, but I believe the family member suffers even more by just seeing their dear and near ones suffer. On the other hand, it will be the responsibility of the Ministry of Health to determine the pharmacies endorsed to carry out the sale and distribution of this substance prior to passing through strict sanitary controls and having a good manufacturing, processing, supervision, and monitoring practices. Having this type of medication puts an end to the ordeal of hundreds of families who became smugglers, unfortunately, in order to alleviate the suffering of their loved ones. In Panama, there are more than 50,000 people with epilepsy problems, and 30% of them have refractory epilepsy. This one is hard to control with traditional medicines, but now, hopefully, with the passing of this bill, they will have some relief. However, this initiative strictly prohibits the commercialization of products derived from medical cannabis at home or via the internet within the country. Next slide, please. After an open, intense, and continuous discussion that lasted over 4 long years, Bill 153 of the year 2019 was finally approved in the third reading, which, when enacted, became law number 242 of October 13, 2021, by which the medicinal and therapeutic use of cannabis and its derivatives is regulated. It is commendable that in spite of facing such a complex issue full of taboos and strong conflicting passions, the National Assembly knew exactly how to overcome these obstacles and always kept all communication channels open with the different actors who participated in this long process. Highlights of the points agreed during this reading were: number 1, 7 licenses shall be granted in the first 5 years of the enactment of the law to the interested parties that may apply. Number 2, guidelines will be designed to govern the registration of patients, both residents and foreigners who will be able to access medical cannabis. Number 3, the use or consumption of medical cannabis must be kept solely at the discretion of the doctor, who is a suitable professional and will prescribe according to what's best for the patient. And lastly, cannabidiol should be removed from the official list of controlled substances, since this compound by itself is not listed as such by the 1961 Single Convention on Narcotic Drugs of the UN. The World Health Organization on December 14, 2017 also made a public recommendation that CBD should not be classified as a substance subject to international control. This position was strengthened and formalized through a report made by the WHO Expert Committee on Drug Dependence, which was presented in Geneva at its 14th meeting between June 4 and 7, 2018, where they concluded the following. Number 1, CBD does not exhibit effects indicative of any substance abuse or potential dependency. Number 2, there is no evidence of recreational use or of any related public health problems associated with the use of pure CBD. 3, there's no substantial evidence that CBD causes psychoactive effects similar to THC. 4, clinical studies have reported that even high dosages of oral CBD do not cause THC-like effects, such as impaired or increased heart rate or tachycardia. 5, the possible toxic effects of CBD have extensively been reviewed, concluding that it has relatively low toxicity. the adoption of Law Number 242 on October 13, 2021, which regulates the medicinal and therapeutic use of cannabis and its derivatives, has finally meant a great achievement for everyone as a society. Panama finally legalized the medicinal and therapeutic use of cannabis through a regulation that regulates import, export, cultivation of the plant, and creates a registry of persons authorized to use it for these purposes, becoming the first Central American country with a legal framework of this type. As you can see in the slides, we have the president signing and passing the law for the use of therapeutic cannabis. Next slide, please. Patients now have a safe and legitimate access to medical cannabis. The medical sector now has new therapies and natural and innovative medicinal and therapeutic products available to them. With the start of this new legal industry, drug traffickers have finally faced a strong blow. High time, wasn't it? With a significant percentage of reduction for their market. With this investment of private sectors into this, thousands of jobs have been produced at all levels of the chain, from cultivation to production of derivatives and finished products, as well as in its distribution. However, in order to achieve the above, it is extremely important that the regulation be consistent with the aforementioned objectives, with consensus of all the actors, stakeholders that have participated in this process. We must not forget that the end goal for these legalizations have always been and should always be to improve the quality of life of the patients. Next slide, please. Now I would like to add a personal touch to the speech. A year ago, I was suffering from chronic lumbar pain due to an old lesion I had as a consequence of a fall almost 12 years ago. Yep, it was a case of a very old injury that I was suffering after so many years. For months, no medicine worked. I couldn't sit, I couldn't stand, and that's pretty dangerous for the profession we hold because we need to sit for the most part of the day, right? And I started suffering from cramps, leg cramps, every night. No analgesic pain medicine or anti-inflammatory medicine was helping. A friend of ours recommended the use of CBD oil. 15 days later, the pain had disappeared. But one fine day, I got up and my knee was swollen to the point that I couldn't crisscross my legs, I couldn't do my regular exercises. My knee started retaining liquid. And I had no idea why. That's when my husband said, the only thing different that you're doing is taking CBD. Why don't you stop it for a while and see what happens? In about 2 days, the swelling subsided. My knee came back to normal and I could resume my daily activities. So keeping in mind my experience, I believe the right thing to do was maybe take CBD, but under a doctor's supervision. So I leave to the audience as food for thought to weight the benefits versus side effects. Did CBD help me? Yes, of course. Were the side effects scary? Without a doubt. And with this remark, I end my speech. Thank you. Next slide.
Thank you, Anjana. This is a great presentation. And I'm very glad to hear that you were able to legalize the medicinal use of cannabis in Panama, which is definitely different, even from the status we have in Brazil, when we need to take everything to court to be able to treat patients in so many cases, as the previous speaker let us know. So we would like to open for questions from the audience. You can send your questions using the chat. But I'll start with one. So I understand that now the law has been enacted, but what about the current status? What is the path that people need to take to have access to CBD? So do they go to a specific kind of doctors? Do you have doctors who specialize in the medicinal use of CBD? So how does that go? So that, because I assume that probably you just don't go to the pharmacy and get it yourself just because you want it. You need to be followed by a physician, and probably this is under prescription. So how does that work in practice there?
Well, I can tell you from my experience, CBD oil is readily available. If you check out Instagram in Panama, there are places that sell CBD and you can actually directly buy it from them. Remember that CBD is not the psychoactive substance. However, if you need cannabis for medical purposes, that definitely is going to be under the doctor's prescription, supervision. And you cannot just readily get it. It has to be through a hospital. It needs to require its permissions. And that's what people were actually fighting for, mainly the legalization of medical use of cannabis in the hospitals in Panama. So that is definitely highly regulated. As I mentioned in my speech, there were some points that were discussed while this law was under discussion, and therefore they did mention that there are guidelines to govern the registration of the patients. Patients need to be registered. The consumption of medical cannabis must be kept at the discretion of the doctor. So yes, it is not, that one is definitely not readily available.
So yeah, this is why I asked, because I understood that once the law was enacted, that now some things need to be put in place, right? Some of the things need to really become operational so that people have more access to it. And I don't think we have any more questions from the audience, but I'll ask you a final one. In Brazil, when this process started, it was triggered by families who would sue the government for the right to have access to medicinal use of cannabis to their children, usually. And this is what kind of started the movement of engaging physicians into the discussion, engaging other stakeholders into this discussion. So what was it like in Panama? I mean, right from the beginning, maybe, I'm not sure whether that would be something covered in your talk. So was that something that came from families, or was that something that came from the doctors?
Yes, the initiation was from the families because unfortunately they had become sort of smugglers in order to get the medication for their kids out of, because if you see your loved ones suffer, I think anybody would go to any extent to help them. And it came to a point where families started smuggling the medication in order to help their family members. So they initiated a sort of uh, a forceful expression, a motto, por un día sin dolor, for a day without pain. And that was the very basis of all of the readings that took place in the General Assembly. Unfortunately, it did last nearly 5 years before they could actually legalize marijuana. But on the other hand, the positive effects were that, smuggling stopped definitely. And now you can get it legally, so you don't have to depend on the middleman in order to get the drugs or the medication that you actually need for the sake of your health.
Which is great, because during your presentation, I was thinking about that. It took a long period, but it engaged society in so many levels. And I think that this kind of movement in the General Assembly and in other levels probably was crucial to debunk some of the myth and the prejudice that involve the use of cannabis, and that in other countries are something that's really hindering the whole process. So,
Exactly.
Anjana, once again, thank you very much for volunteering to be our speaker. We really appreciate it.